This is Timothy Benali with the Navajo Nation Office of the Speaker.
Okay, good morning, Tim. Thank you for helping us.
No problem.
Is Donovan there as well, and Byron, or
Donovan's
just you
still getting
today?
on the call, and then I believe Byron is also still getting on the call.
Okay.
Are there any materials that were emailed to the committee? I'd like to pull them up. Thank you.
Yes, I sent out an email yesterday afternoon that was sent from the retirement office. It's the enhanced retirement plan, the proposal that I believe I can't even think this morning, with the Willis Towers Watson that they created, Bayan and Suzanne.
Yes, hi, good morning. This is Suzanne with Willis Towers Watson.
Oh, okay. Good morning, Suzanne. Good to hear your voice. We'll get started as soon as we get more members, the chair and the vice chair on the call, and so then we'll get started. And I haven't heard from Andrea yet. Is she on the call?
I'm listening.
Oh, okay. Good morning. So I guess we're ready to go. Let me check to see what time I sent that email. Did you find it, Deja?
Okay. I'm going to transfer this call to the conference room, so you might hear a click or something.
Okay.
Okay.
I sent out the PowerPoint, the PowerPoint presentation yesterday at 3:39 today, so check your email for that time, and that's when the PowerPoint went out. Do the RPAC members, do you need a copy of that email, or do you all have that PowerPoint? If there were any changes to it or anything like that, I think Andrea sent me the last one. Because I can email it out to you if you need it.
Peggy, this is Rosita. Did you send us a copy? I know I got one from someone yesterday. I'm not sure if it was from you. The PowerPoint presentation?
Hold on a second here. No, I just sent it to the Budget and Finance Committee and also the staff, Kristen, Dana, and Ramona.
Okay.
Did you want a copy of it? I can send
yes,
it to you.
please. Yes,
okay.
Thank you.
Can you help me by naming the RPAC? I was trying to remember everybody.
Okay. Perlene Kirk, Controller.
Need the projector?
Joanne Jane, Chief Justice.
I guess we just can turn it on.
Yeah.
Perlene Yellowman, Division Director for Community Development. Jimmy Yellowhair, Council Delegate, Raymond Smith.
And then President Nez, right?
Yes.
Or someone. Okay, I think I got it then. So,
thank you.
Oh, you're welcome.
Peggy,
Yes.
I think Jackie Cardell emailed it to the RPAC members, but if you want to resend it, you can.
Okay, I'll just go ahead. Thank you.
Thank you.
Okay, Budget and Finance Committee members, how many are there, or do you want to just start? Is Chair Henio or Cecilia Raymond Smith, Vice Chair? Are you on the call yet?
Good morning, Shada. I've been on the call for a while. Just waiting for Chair Henio. Is he on board?
I haven't heard. So we have Shadeja Amber Crowdy on the call, and I'm not sure about anybody else. I haven't heard.
Kogoshi, I'm just opening up the agenda. Let's get started. Work session at 10 a.m. I'll call the work session to order. We don't need a quorum. We don't need a roll call. But I'll ask for invocation. Is Jimmy O'Hare, are you on board? Erota Shada. Erota Nathaniel Brown, Honorable. Nishide Yashamayaja, Amber, Honorable.
Vice Chair, this is Chair Henio here.
Okay, Chair Henio.
Can you hear me?
We can hear you loud and clear.
Okay.
Invocation.
Having issues with my dang internet here. Okay, let's get started. We have it's at 10 o'clock. It says 10:08 now. It's a work session, so we don't need a quorum. So with this, we'll call the work session to order. It is 10:08 a.m. With that, we'll move forward on our agenda, and we have an invocation. Now, Vice Chair, would you could lead us in prayer this morning?
Hagushi Chair Henio. Shink Ado, the citizen, so the Schlichty, then he citizen, she don't know. It, they benefit Schnido, Shink Art Code. She and Hush on the he caught it with teacher on the work session, the yay, the Honda, the Shiggy retirement of the Benigi, even yet, the Kato, the Yay, the Ados, they all presenters on Benigi, which one Lolo, called it down here on the Sholo. A box of the Sinchdian, she on it, so it's in the Hododo, not Jay, Quichin, he couldn't eat on, Hajimpa, she did a shoulder. I don't hear now, quite big Zazo, Shaznido, Ayat, and Astley. Called Garage Institute. A hash again, although the Aquichay, not sure a no what me don't buzz and all, injured the date Ashtian, called here line Tado, which had called the Hinamisha, the Nachaya, at the deal is a show. And yesterday, the lately the retirement, called. Naniste Spondo, Sashib Biyad, I see Pokazlito, Biyad Hatahotordi, a code that the Nache Habe Ahatos Nito, BNF committee members, Tunzo, the Nache Naidi Kito, the Gaspazando, Naspen Yegi, Sadana, wait, I adored so. Eben ye code in Gaspazando, Donan Cladona Kindlo, Eben ye code, I don't, his staff and Lenigi, Eben the Hundo, so he been Anish Latin Tazun, and he Nanish Taz, I don't call retirement staff and Lenigi, though, our pack that the Lenigi. And he tries the Hundo Stiana Skoda. I don't hear Chindo, he's so keda. He another keda. I don't hear Madon, his share. I don't hear Naladon, his shadon, he mustn't. But for the son, with Hundo, he hear la Koda. Then he could go Asto and Johnny at in Anishikatini. I put out, she will so, bit sort of thing. And Jesh Digan Koda. And you get Bishop Nache had Stido. Jesus Christ, Amen.
Kashika for that parish and although with that for the meeting members we do have a work session agenda moving forward, recognizing guests and visiting officials. We do have our Budget and Finance Committee members. Before that, let's do a roll call. I forgot roll call. Ramona, are you on the line with us?
Yes, Chairman, I am.
I'm sorry, I forgot to do roll call. Could you do roll call for us? I'm hearing the other committee members coming online.
Sure. Roll call for the Budget and Finance Committee of the Navajo Nation Council, work session, February 23rd, 2021. Jamie, can you on your location, please?
I'm present. I'm in Raymond, New Mexico.
Thank you, Chairman. Raymond Smith Jr., and your location, please?
Oyate Ben Chanela, Tessa, Arizona. I'm present.
Thank you, Shanella. Oh, good morning. Jimmy Yellow Hair, and your location, please? Jimmy Yellow Hair? Eleanor P. Begay, your location, please?
Yat Ishideja, Shane Le Tapin Kaho, Johnny Bushis Unduraga.
Thank you, Shana. Amber Kennisbach Claudia, and your location, please?
Yat Ishade, Delegate Amber Canisbach Crotty. I'm calling in from Window Rock, Navajo Nation. Thank you.
Thank you, Shadeja. Nathaniel Brown, and your location, please? Nathaniel Brown, and your location, please? Nathaniel Brown. Chairman, we have 4 members present, 2 not answering upon roll call. Chairman.
Okay, thank you for that roll call. Let's move forward with our recognizing guests and visiting officials. We do have our Budget and Finance Committee members, also our staff, legislative branch staff that's assisting us this morning. Do we have Department of Retirement Services on the line?
Good morning, Chair Henio and Vice Chair Smith. The retirement office is on the line along with our actuary, Willis Towers Watson. Thank you.
Thank you. Yes, who's this? Okay, thank you for that. Do we have our principal attorney on the line, Ms. Kristen Lowe?
Good morning, Chair. This is Kristen. I'm on the line.
Okay, good morning. Do we have Department of Justice on the line also?
Good morning. This is Rudy Nair with the Tax and Finance Unit, Department of Justice.
Okay, good morning. Also, do we have members of the Retirement Plan Administration Committee on the line, which is our controller, Ms. Perlin Kirk.
Oh, Hakoshina.
Ms. Perlin Kirk, are you on the line? What about Dr. Pearl Yellowman? Okay, well, I heard Ms. Resita Toddy on the line earlier.
Chairman Henio, I'm still on the line. Thank you.
Okay, good morning. And then do we have Chief Justice Joanne Jane or designee on the line? Okay, with that, we have one member of RPAC on the line. With that, who else is also on the line on this work session joining us?
Chair Henio, good morning, members of the committee, retirement services, and this is Yolanda Ciccarello, Program Supervisor for Employee Benefits Program, Insurance Services Department. Thank you.
Okay, good morning.
Good morning, Mr. Chair. This is Shonovan Dale with Risk Management.
Good morning, Shonovan.
Good morning, Chair. This is Byron Shorty from Speaker's Office.
Good morning, Byron. Okay, I believe that's pretty much everybody. I don't know if we have any other Shnada can Bishma Sana listening in.
Good morning, Mr. Chair, members of the committee. This is Mel Rodas from DOJ.
Okay, good morning, Mel. Okay, with that, let's move forward. Peggy, could you read the proposed agenda into the record for us?
Yes, Chair. Hold on a second. I'm doing a bunch of things here. Okay, this is the proposed agenda for the Budget and Finance Committee for February 23rd, 2021 work session via teleconference. Presiding is Jamie Henio, Chairperson, Raymond Smith, Jr., Vice Chairperson. And 1, call the work session to order, the roll call, the invocation. 2, recognize guests and visiting officials. 3, review the agenda. And then 4, receive reports. A, retirement plan for employees of the Navajo Nation and participating affiliates. 2021 Navajo Nation Enhanced Retirement Program presented by Andrea Holmes, Plan Administrator, Retirement Office, Suzanne Wyatt, and Bayan Solman, Willis Towers Watson. 5, close of the work session, written announcements, adjournment. The next regular meeting is March 2nd, 2021.
Good with that, committee members. Any questions or comments on our proposed work session agenda? Let's move forward. We do have this agenda before us, and let's move forward with our agenda as far as our work session is concerned. And we do have no reports, no journals, and then there's next item is report, Sigi, which is we do have a presentation from Navajo Nation Department of Retirement Services. With that, Ms. Andrea Holmes, if you would lead us off on this work session and for the Budget and Finance Committee.
Okay. Thank you, everyone, for joining, and thank you to the Budget and Finance Committee to allow for the Navajo Nation Retirement Services to offer this work session regarding the retirement plan, which is named as the Navajo Nation Enhanced Retirement Program that we are going to be going over. And I guess to kind of give a little bit of insight, the whole objective to this enhanced retirement plan was mostly for the people who are at risk for the COVID-19 when it came last year, March. And with the enhanced retirement program, of course, it's voluntary. And when we asked our actuary, Willis Towers Watson, to do a study because it was introduced by the Office of the President and Vice President. And during that time with the COVID-19, last year on the rise, was really affecting our elderly people or the population. So what we did is we went back in July with Willis Towers Watson. We gathered some information, and out of the data that we provided to them, the information came out along with the cost. And since July last year, we've been trying to implement this enhanced retirement program, and we were only looking at people who were 60 years and up. So those are the regular status employee with the eligibility criteria, and we excluded the law enforcement officers, we excluded the judges, we excluded council delegates and the political appointees along with temporary employees. So this, the data that we provided to Willis Towers Watson was only to look at the individual regular status employees, and because of all the COVID shutdown, that's where we went with the normal retirement age of 60. Although it was mentioned, what about the early retirement program? Early retirement starts at age 55 for the Navajo Nation, but because we were only focusing on the elders, we went with the normal retirement age of 60. And back then we introduced 4 alternatives. Based on the alternatives, the first alternative was to offer 3 years of benefit service and with insurance at I think it was 100%. And then the second alternative was to offer 3 years of benefit service, but then we split that benefit service to be a 60-40 on benefit, 60%, no, 70-30, I'm sorry, 70% to be paid by Navajo Nation and 30% to be paid by the employee or the future retiree. And just knowing the costs on that, because they were still age 60, Medicare doesn't be eligible for them until 65. So that's why we added the insurance at a 70-30% split to offer them the medical insurance. The alternative 3 was to add 5 years of benefit service to the individual and no insurance. The fourth alternative was to add 5 years of benefit service and give them a lump sum payment of $5,000, assuming that they would use that $5,000 towards to purchase medical insurance. But I don't know if that was the most expensive alternative. So we just went with, these were some of the alternatives that were offered, and what we tried to think about how we could benefit the future elder or retiree that are affected and would take the enhanced retirement program. So those that were at age 60, there was 698 or 3 that were eligible for this. And based off of that, we looked at the cost, the alternatives, and what we could do for them. So that's kind of like where we're coming from. And so we presented this different times, and during those times, now we presented to RPAC at the last meeting, which was January 29th. And during this last meeting, the alternative was in discussion again, and so it was passed, but with no insurance. So we named it Alternative 1, and the Navajo Nation still would offer the 3 years of benefit service, but with no insurance, just due to the fact of costs and, the effects of that. So that's how the RPAC looked at the different alternatives and to assist or to help our 60-year-old elders to retire. This is what's on the table now. But what I asked Willis Towers Watson to do, which is today's presentation, is to include, just to show you if the insurance was to be still on the table. It was just a comparison so you can see that. So that's why I made this request to Budget and Finance to kind of show and let you know what the retirement office is offering to our Navajo Nation employees. So once all this goes into place, of course, we can figure out the next step in discussion of how we're going to do all this. So if you look at the presentation, that's where Miss Suzanne Wyatt and also Bion Solomon, they put all the data census, the information, the costs, and that's where we're going to go through a discussion on the work session to allow you to get a better picture of what we're doing. So I just wanted to thank the committee, Budget and Finance Committee, to allow us to let them know that there still is a need for the COVID-19 who are affected, along with, that we're still vulnerable. So it's still affecting our elders, even our workers that are essential or even non-essential. So with them up in age, these are what we're offering right now. So I'll go ahead and turn it over to Willis Towers Watson. They can go over the presentation, and if you have questions, they are here to hopefully answer the questions that are, still at questions. So I'll go ahead and turn it over to Suzanne Wyatt and Bion Solomon, and they can do the presentation. Thank you, Chair Henio. Suzanne?
Yes, hi, Andrea. Thank you. I think you've touched on some of the points earlier on the presentation. Good morning, Chair. Good morning, committee members. Thank you for having us. As Andrea mentioned, one of the main points of this work session is to go through, what is the enhanced retirement program being proposed, sort of the considerations in implementing such a program, benefits to the elderly offset by, cost to the nation, to the plan, and to be available to answer any questions you have in getting comfortable with the offering, to be able to at your next meeting, either confirm or deny the program, as well as sort of fine tune any design aspects. Just looking back a little bit, as Andrea mentioned, this program's been looked at for several months now. It started because of COVID to try to target those most at risk and allow them to be able to afford to retire and not having the stress of feeling like they need to go into work during the pandemic. There were several designs looked at, and RPAC has come down to the design, which is very similar to what was offered back in 2009, which is to enhance the retirement benefit by offering an additional 3 years of service to those who accept the program. And Vian will walk through some of the numbers of exactly how that looks and what that means. Another area that was sort of in question was whether or not to offer, in addition to the 3 years of service, any enhanced medical benefits. And just, for background, back in 2009, medical was offered where the nation covered 70% of the cost, but the retiree had a 30% cost sharing portion. So there was a pretty generous subsidy there of 70% of the cost of continued medical through age 65. So kind of with that background, the materials that we have an agenda which starts with a glossary of terms. I'm not going to read through that, but just in case I use any kind of technical actuarial terms that you're not sure of, you can flip back to this page and get a definition of it, or just stop me and ask, what does that mean, or what are you referring to there? On slide 4, sort of summarizing the objectives there that I think we've talked through, mainly voluntary program targeting those at risk of COVID. Slide 5 goes through the eligible population, which, as Andrea mentioned, it would be targeting regular service employees only, viewing judges and commissioned law enforcement and some of the other participants in the plan as, essential workers that the nation couldn't afford to lose, so we wouldn't want to encourage them to retire. So looking at those age 60 and up, for reference, back in 2009, it was age 55 and up. But as Andrea mentioned, the purpose of this program was to target those at risk of COVID. So age 60 was selected. And those who had at least 10 years of service with the nation, somebody who's just worked here a couple of years, it doesn't make sense to give them an additional 3 years when they've only already worked 2 years for the nation. So somebody who has had some significant service with the nation, to reward them for their long service, offering an enhanced benefit. Initially, when we were looking at this, as I mentioned, it was several months ago, so most of the analysis looked at those who are 60 and 10 as of December 31st, 2020. At this point in time, we're looking at possibly moving that date up to anybody 60 and 10 as of March 1, 2021, so a few more months to be able to age into being eligible for the benefit. So let me stop there, pause real quick, and see if there are any questions to this point. Okay, moving along. Slide 6 breaks down this eligible population group into age and service buckets. So you'll see in total, there would be roughly 700 people who are eligible for the program, about 201 of them age 60 to 61, then 62 to 64, 246, and these are folks who are starting to become eligible for the early Social Security benefits as well. And then those age 65 plus, 251 of folks in that bucket. And those would be folks who are eligible for Social Security as well as Medicare medical coverage. So that's the way the population breaks down. If all these folks decide to take advantage of the program, their earnings of roughly $32 million of payroll per year, that payroll cost would go away because they'd be retired. However, consideration would need to be given to filling their position if they were in an essential function. So potentially you could fill the position with somebody younger and lower paid, but potentially not. So there is some potential savings, but it's only realized to the extent that the positions aren't refilled at the same pay rate or higher. Slide 7 goes through high level some of these considerations we've touched on. It's a voluntary program, so it's very difficult to control how many people will accept the program. In a normal situation, usually it's roughly 30 to 50% of the population will accept a window offering. But given the pandemic, we're expecting that there'd be a lot higher take rate from people than in a usual environment. You can't control who takes the program, so you could have folks take it who you really don't want to leave the workforce. So as we mentioned before, you don't want to lose essential personnel. So that's one of the reasons that judges and law enforcement were not considered for part of this program. Have to consider the time that it might take to replace or rehire those people, the knowledge that you're losing. Training the replacement can be very difficult if somebody essential leaves and they take their skills and knowledge with them. The potential positive effects, elimination of any unnecessary or redundant job functions where you basically have two people, but you only really would take one person to do that job. Filling the position with a lower cost, younger person. Promotion opportunities, maybe you've got somebody who's older who's staying in the position, so somebody younger isn't able to be promoted where they're ready to be. And just the messaging, if you needed to downsize your workforce and you lay people off, that really not only affects people laid off, but it affects the people who stay because they see that they could potentially be the next one laid off. So this is a voluntary program. It's not telling anybody they have to leave. It's if you want to retire now, we're giving you some extra benefits. And it's also protection against bias challenges of age discrimination. Okay. Moving on to slide 8. This is the enhancement that has been decided on by RPAC, which is to offer an additional 3 years of service, which would, because the retirement plan basically works by offering a lifetime income benefit equal to 2% of final pay times service. The additional 3 years of service would translate to an additional 6% of final pay as a lifetime benefit. And Brian will talk us through some numerical examples of how that might look. One alternative that wasn't fully baked was whether or not to offer medical coverage in addition to the 3 years of service. So the medical coverage offering, Brian will talk through what that would look like and some of the costs involved. But basically, this would be something to bridge to the Social Security eligibility. So it would only be those who are under 65, and they would have continued medical coverage to bridge them to that point to be able to afford medical coverage in addition to their daily expenses until the Social Security benefits kick in. In order to produce those costs, we got some costs of what a pre-65 medical plan might look like from the Department of Insurance. So the cost estimates you see in here are based on data provided from the Department of Insurance. Next slide, some kind of pros and cons of looking at medical coverage. The cost numbers we put in here are assuming the nation would just cover 100% of the medical to 65, but that could be prorated, something like 70-30, as was done back in 2009. So for the retiree experience, it would bridge them to Medicare eligibility. Some retirees may opt out, but to the extent that the nation's covering 100% of the benefit, I'm expecting most of them will opt in. If there were cost sharing like 70-30, those who have maybe a spouse plan or another option might choose to take that other option. The portion paid by the Enhanced Retirement Program would be taxable income to the retiree unless the program is structured as a retiree medical plan. And to do that, it would be some amendments to the active medical to sort of make this sort of a sub-plan of the active medical. So there are a few steps that could be taken that would make this a tax-free bridge as a medical benefit pre-65. What would happen post-65, though, for folks who have taken this program, they would need to transition to Medicare. So at that point, the enhancements from the nation would stop. And to the extent that the nation was covering 100% of their cost would actually increase now because they'd have co-pays for Medicare benefits. So just a consideration there. If there is cost sharing, something like 70-30, then it might be somewhat of a seamless transition from a cost perspective. We've talked a little bit about the cost impacts. We're going to show some numbers here, but they're based on Insurance Services Department doing an analysis and providing what a pre-65 retiree plan might cost. From an administrative perspective, there would be some additional work for the retirement office in administering the medical coverage. It's not just payments from the typical retirement plan, but it is a special benefit, and they'd need to coordinate and work with insurance services. They're ready to do that. They've had some discussions, but it is an extra burden for both departments to administer the benefits, this extra plan pre-65. So just some considerations in terms of offering the medical. With that, I'll pause for questions, and then Bayan can talk us through, starting on slide 10, some numerical illustrations and what the cost might look like for these enhancements.
Chairman Henyo, this is Delegate Crotty with the question.
Yes.
Go ahead, Shananta. You have the floor. I believe they yield for questions. You have the floor.
Thank you, Chairman. I wanted to just follow up on the conversation regarding the health insurance. Let's see, so that slide. If you could just help me, what number slide is that? And
slide 9, I think.
Slide 9, thank you. And so in looking at slide 9, I appreciate the high-level summary. What I'm looking at is the cost impact. And so just to be clear, is this, so is this the cost that the retiree is expected to pay, or is this the cost that retirement office is anticipating to supplement?
That's a great question. So the medical benefit as part of the ERP is in flux. So if, for example, full medical coverage pre-65 is part of the ERP program, then the cost, additional cost for that medical coverage would be this $522.52 per month for each retiree, estimated to increase at 7.1% per year with medical inflation based on historical experience. And that would be to cover medical, dental, vision, under a similar plan to what they're currently in as an active employee from the point of retirement through age 65. That monthly cost would be a subsidy as part of the ERP if the committee decides to include an enhanced medical subsidy as part of the program. So that's somewhat in question. Like if they don't cover any medical, then the retiree is on their own to purchase medical. So just as a data point, the COBRA rate that the retiree could be eligible for is the $349.96 per month for 18 months. There's some benefits there, to the retiree of taking COBRA and having that lower cost versus if their active plan continues having to pay the nation paying the $522.52 per month. And then it could be any portion thereof, right? The nation could say, well, we're not going to pay the full $522, but we'll pay 70% of it, and retiree, you're on the hook for 30%. So that's one of the questions: is will medical be subsidized, and if so, at what level? 100%, 70%, some other level? Does that answer your question?
Yeah, that's that answers the question. And for some clarity, Chair Henyo, if I may ask, if retirement could help us understand currently, so when Navajo Nation employees receive their benefits, the nation does pay, and if we want to call it subsidize, a portion of that benefit. Do we know what rate we subsidize versus what the employees? So that's what I'm trying to gauge when they go into this pre-retirement. What's going to be either the cost to the nation or the cost to the individual? Does that make sense? I could rephrase.
Okay, thank you. Andrea?
Okay. Thank you, Chair Henio and Honorable Cardi. If we decide to do the medical, those were off of the slide that Willis Towers Watson is, excuse me, is using. It's a 70-30, I guess, a split. But I know Yolanda Chicharello is on the line, and as far as more clarity to what Suzanne explained, what Navajo Nation is offering for the medical, vision, and dental, that's the $522.52 versus the COBRA amount, the $349.96. But I'll ask Yolanda to better clarify with the insurance. Yolanda?
Good morning, members of the committee, and also Honorable Chair, or Honorable Crotty, sorry. So as far as the premium rates are concerned, the Navajo Nation currently with the health premium as a regular status employee, we have a 90%, 10% split. So the Navajo Nation is able to fund on behalf of the employee whose regular status at this current time, 90% of the premium out of the fund, the group health fund. As we presented to the retirement program when they requested what the rate would be for a pre-retiree, we took into consideration our past experience, so we came up with a rate of over $500 per insured member to continue with the medical, dental, vision, and pharmacy plan. Again, that is based on past experience when we did the pre-retiree plan, the early retirement back in 2009. The fund did have a loss, and so that's what was given consideration for this upcoming proposed retiree plan. And so the difference between offering the health plan with this pre-retiree package is that an employee who takes this package and is at age 60, they can continue on the health plan for the next 5 years till they reach Medicare age. So the benefit of that is that they'll be able to stay at this rate for the next 5 years and be able to keep the plan. Now, for those that are not considering to take the plan, they might choose to have the lower rate, which currently is at $349.88. But that would only limit them to being eligible to keep the health plan for the next 18 months. So then what would they do for the next 3.5 years? So that's a big difference in this retiree plan if they're age 60. Now, if they're age 64 or 63, it might be better for them economically to take the COBRA rate instead of participating in the plan, the health plan offered through the retiree package. If it is going to be included, they might rather take maybe a lump sum if that would be offered in lieu of. So that's the difference. So, and then what the cost would be to the retiree is dependent upon how the committee decides to include and subsidize the premium on behalf of the retiree. Thank you.
Thank you, Chairman Henio. This is Delegate Cardi with another question.
Go ahead, Shananta. You have the floor.
Thank you. I appreciate it, Chairman. And maybe if this could be insight from the retirement committee. And thank you. We've had several presentations regarding different plans. Chairman, could you help me understand at one point if there was a conversation to maintain that 90% for Navajo Nation to assist, and then the 10% from the employee, and I don't know if that was a decision made, and if you could give me some insight on why we're at the 70-30. Thank you. Or anyone on the call. Thank you, Chairman.
Okay, thank you for that question. Committee members, any other questions or comments? Sorry, turn back over to our presenter.
This is Del Guriel here. Yate, good morning. Can you hear me?
Yes, Delegate Yellen here. We can hear you.
Okay, Yate, this new retirement plan for this coming year, it's really good for early retirement for those people that are like 60 years old. It helps them with their insurance on that one, based on that one. But once you get to 65 years old, you're gonna have to get into Medicare with the work with the IHS, and for those, we had advantage on the insurance for those younger ones. Anybody going to leave early, and also it depends on their own voluntarily retirement. It's up to them if they want to go retirement now, but it helps them with their insurance. But most of it, with my experience, I go to Indian Health Service. I'm over 65 now, and I go follow with the Medicare to take care of my stuff up there, like any major medical stuff, and that helps me. But for early retirement, it helps them because it's all the next three. If you're going to retire 62, you have 3 more years, have an insurance, everything's covered. Your visions and your anything medical, it covers. It's kind of work for them. It's really helps them. That's what I see in this retirement, and it's good. And then all based on how many years you put in, a 2% too, what their formula they use. Then needs to be very good educated on that one. Anyway, kind of understand. I support this one here for early retirement for those who want to leave another job somewhere with another company. Everybody sees so that check. So yeah.
Okay, thank you for that.
Andrea can correct me.
Back to Andrea.
Okay.
Phones and your staff to give as far as that question regarding the 90%, 10%, and then the 70 and 30%, as far as the discussions we've had with the administration during the meetings, and then how we came to that conclusion.
Okay. Thank you, Chair Henio. Thank you, Jimmy Yellowhair, and of course, and Ms. Honorable Cardi. The discussion for 90/30 that was mentioned became 100%, and that was an alternative 2, where the Navajo Nation would pay. We called it 100%, but I guess there is that split of 90/10. But the 70/30 is the alternative 1, where Navajo Nation would pay 70% of the insurance, and after meeting with the employee benefits on the insurance premiums, $522.52. 70% of that is $365.76. So the Navajo Nation would pay for that. The 30% would come out of the retirees' monthly pension, which would be $156.76 if the insurance was to be back on the table. And the 70/30, to go back into history, 2009, the Navajo Nation offered a special retirement program, and that's where the 70/30 is coming from. Just knowing how we kind of already went through a 70/30 split for the insurance to cover medical, vision, and dental. And so this is where we just carried it forward, knowing that we're trying to make things a little bit more affordable, of course, for the nation, but then also give some responsibilities to the future retiree if they are interested in continuing insurance. And then, like Yolanda Express, you know, COBRA is there, but it's only good for 18 months after the employee decides to retire, but it's also based on the age. And they might only, it might be cost effective for them if they're 64 and they just want to carry COBRA for a few more months. So it really depends on the retiree. There is 698 retirees who are eligible to receive this retirement opportunity. And if we're looking at people who are, I'm going to say 65 and over, there's 251, and where I'm getting this number is off of slide 21. It has a breakdown of the ages of how many people are eligible. And so we did present this to the RPAC committee, and because of the cost factors, the insurance was, we only went with alternative one with no insurance. So that's where this all comes out with the employee benefits portion. So the 70/30 is from a prior experience in 2009 with the SRP. And even though we said, what about if the Navajo Nation can pay 100%, that's in another presentation that was presented back in like July, maybe August or September. That presentation shows the alternatives on there. But we do have the costs on that if we needed to go back and do that. Does that answer the question?
Yes, that gives some insight. So if you could let me know then if that was an option, at what point was that option not moved forward or recommended? And if you could give me an idea from 2019 of the employees who are eligible for early retirement, how many of those employees wanted or move forward with the insurance? And were there any issues or anything that we could learn from that experience? Thank you.
From 2019 or 2009?
2009.
2009, at the time the special retirement program was introduced, there was 904 people. And out of the 904, only less than a third took the SRP. And as far as the insurance, we had about, how much was it? I don't know if Yolanda recalls that took the insurance.
Maybe about 2/3.
2/3 out of the third. So out of the 300 individuals that did retire, about, Delphine is remembering about 2/3 out of the 300 took the insurance. I'm not sure if Yolanda has a better number to give you, but we did work with employee benefits on capturing those amounts and deducting from the retiree's monthly pension. But this one, we're looking at 698. And back then, when the special retirement program did happen, we looked at early retirement age. And so that's why the number is higher, 904 people. We went from age 55 to, of course, 65 to allow those individuals who were eligible to retire. So about less than 300 took the retirement SRP back then. Yolanda, do you have a number from the 2009 on the insurance.
I can get a number. I don't have a number on me now, but about 300 sounds about right.
Yeah, I think a lot of them, because they were only age 55 to 65, I know it's a little bit over half took the insurance, just due to the fact it included the medical, the vision, and the dental. But this one, we're only starting from age 60 to 65. And out of that is the 698 total that are eligible. Oh, 190. That's roughly how much took the insurance back in 2009. Does that help?
Yes, thank you. That helps. And I would want to know if you have the data, because what I'm looking at is if the retiree not only can, that the amount that's a cost of living, like that's an amount that's available, that they're able to live on. I'm also curious if you could maybe in a future discussion, if those 119, how many of those retirees were able to sustain and pay for that insurance. What I'm hearing from individuals who took the package back in 2009 was they felt there was additional benefits that would be covered, and then felt that it wasn't really in their best interest to retire early because many of them were either forced to get a different job or return back to the Navajo Nation. And so if the attempt here is to provide early retirement, I would want to at least address those concerns that were raised in 2009. Thank you.
Okay, thank you, Amber. Ms. Honorable Cardi, we can provide data, but also keep in mind, back in 2009, the Special Retirement Program was early retirement incentive. And now here in 2021 or 2021, our objective is for eligible employees who are 60 years, which is normal retirement age. We're not going to do early retirement. We're only going to start from normal retirement age forward for the 2020 Enhanced Retirement Program, not early retirement. And that's where there's a difference. Before we did do age 55 years old, but today we're only looking at 60 years old, which is the normal retirement age forward, because COVID-19 is, I know it attacks everybody, but we're looking at 60 and above for our employees to retire.
Any other questions or comments, committee members?
Chair, this is Delegate Yellow here.
Yes.
So, ita 2009 ita there was a special bonus too. But they like, if you were like maybe 55 years of age, they gave him 3 years as an add-on about the extension. For that was one of those years add-on for them. If I'm right, yeah. I think they would take us additional 3 years to add on to their retirement. Although I know a lot of them, they left, but they thought they got a lot of money. But it's all based on your annual salary. You have to really watch your salary. If you have a higher salary, that's good retirement. That staff got cleared on Lindy. Their salaries are small, very 28,000. That's another the problem they're going to have. They understand that one because they need more education. But this package is only good for get 60 years, above 60. It's good because we're going to have less money that we're going to have to work with in retirement. But we still need to find some money anywhere, like $10 million more to be on save for entire Navajo Nation retirement. Less expensive with alternative one. I think I need help right here so we can understand it. I know this one was without insurance, I shouldn't say, but the package here is going to be only cover insurance for those 60 to 65 with age. Correct me, please, if I'm wrong. That's advanced for the who are 60 years old to 65. It's good for them because the medical is covered 100% on the Navajo Nation. But what they package is good for them. If you're over 65 or 80, you had a good Medicare to take care of another area. You have to pay. You have to be on your own from there on. With that quick area, so correct me, please. Chair. Thank you very much. Yeah. Once today, still go back on mute now. Thanks.
Any other comments or questions, committee members, on what's being presented as far as early retirement? Because this subject will be coming before Budget and Finance and the legislation that will be presented. The legislation will be dropped this week, and I'll be sponsoring that legislation as far as on behalf of what was decided. And the big question that kept coming up during our deliberations on this early retirement was the impact of how much it would cost the nation as far as paying out early retirement, because there is a lot of inquiries. Once the word got out back in, I believe it was August or even before that, when President Nez was on his town hall meetings, he made that known that this is what will be happening. And next thing you know, retirement office were flooded with calls asking about early retirement and so forth. But through the months, and we've had issues with meetings because our controller is an integral part of the RPAC when it comes to the financial aspects, and their office was busy with the CARES Act distribution. And so, but at the last meeting, the decision was made to move on it. So it will be a legislation that comes before Budget and Finance, and Budget and Finance is final authority over this matter. So and I get a work session to get a better understanding of what this early retirement package will be. And the main thing is the cost impact. ADG is one of the big questions there. So with that, back to Andrea, if you have anything more to add.
Chairman Henyo, this is Delegate Crotty.
Shananta, go ahead. You have the floor.
Thank you. I appreciate that. Chairman Henyo, so if you could enlighten me on what slide or on the legislation how does the nation anticipate to not only fund the initial retirees this year, but the next, let's say the next 5 years? I know we have had conversations about the portfolio and the need to hire more individuals to contribute. Could we have that discussion, or if you could shed light on how this is going to be funded? Thank you.
Thank you. That is one of the big questions that we've always had as we were going through this deliberation. The legislation hasn't been developed yet. I haven't made that request. So I'm still waiting on gathering documents from retirement services. So once the whole package is complete, then I could take it over to Legislative Council for drafting. But as far as on the slide you gave, maybe Ms. White, if you could point out the part of the slide that maybe we can help best have a good response.
Hi, everybody. This is Brian Sullivan. I apologize for Ms. White. She had to drop off due to another engagement that came up around 10 a.m. But I'll point you guys out to slide 11. Well, actually, let me move over to slide 22 first, just to kind of give you an idea. So you can see slide 22, we're showing the impact, assuming everybody took the offer. So under the blue, the proposed enhancement, which is just the 3 years of service, we're expecting the impact to be 37 million, and with the medical to be around almost 45 million. So now I'm going to jump back to slide 11 really quickly. And what we're doing with slide 11 is we're saying, all right, so we've gone, as Suzanne had mentioned before, we don't expect everybody to take the offer, but because of COVID, we expect the offer to be higher, to be accepted higher at a rate that's higher than normal. So at this point, we're saying around 61%. And the way we came up with that is, if you're older, the chances you're going to take the offer is higher than if you're maybe like 60 to 62, the chances you're going to take it is low because you're younger, you maybe want to work a little longer. Right? So that's where the 61% comes from. At the same time, we're saying, well, if you have these people retiring, you've got this position that you have to fill. So we're 70% of the payroll that's already been offloaded, that's going to be used to fill in the positions, some of the positions that have been vacated by the people retiring. So that's what that 70% of payroll savings spent to replacement hires means at the top of the page there. Now that I've talked about those two, I'm going to go down the numbers. So we see that the cost of enhancement of the blue columns are 22.6 million. So that's saying around 61% people accept it. The payroll savings will be around 27 million. So the net cost savings of 4.5 million roughly. And then if we go down where it says calendar year 2021, we're seeing what we expect the funding for that, how this to impact the funding is an increase of 2.2 million under the blue column. At the same time, a decrease of payroll 8.5 million. So there's a net cost savings around 6.2 million. So how is this expected to be funded? Same way as the normal funding for the plan, for the pension plan, which is under using the fringe rates. And if we use the current methodology of 15-year amortization, we expect the fringe rate to increase by around 2.2% roughly. Now, if we look at the green column, that's with 100% medical paid by Navajo Nation. Same logic. We expect the increase to go up by around 2.4%.
With water too?
No, not yet.
No, I haven't got on that. So what?
Okay.
No, should I'm going to repeat the game. Can you mute your phone, please? Go ahead, Brian.
Hello?
We can hear your conversation if you can mute your phone. Brian, go ahead.
Yep. Sorry. Were you guys hearing me from the last like 3 or 4 minutes?
Yes.
Okay. Just making sure I wasn't talking to myself. Right, so that's slide 11. That's basically how we expect this to be funded, and that's through fringe rates. And roughly, we expect it to go up by between 2 to 2.5%, depending on the what level of medical is provided.
Excuse me, Silla. This is Delegate Yellow here. What slide are you talking about? I know what I'm looking at, but I want to make sure that you're talking about the right thing on your based on your slide here. What slide are you
slide
talking
11.
about? Okay, that's good. See, you need to mention that one by slide 11 so that they can understand where you at. Yes, Chair. Thank you.
So, are there any questions on slide 11? Okay, with that, back to Shananta. Delegate Amber Knusbach-Crotty, do you have a follow-up regarding your initial question?
Thank you, Chairman. Just trying to follow the PowerPoint. So slide 11, I'm going right back to it. What I'm asking, Chairman Henyo, and maybe you can help me, is if this is moving forward, RPAC approves, it goes to Budget and Finance. The financial, I'm looking at the financial impact because there's also a slide here. I'm moving back to it. I apologize, committee members. I thought I saw there's one slide if we don't hire, if there's not a rehiring. Maybe
slide 23?
Was that slide 23? I could have read that wrong. And so I think what I want to know is, oh yeah. So I would just need to know is, I'm hearing COVID and I got some background noise. I'm sorry. I'm doing some. So is this proposal by President Nez and now by RPAC, is it to help retirees who want to transition out because of COVID and their health concerns? And looking at slide 23, now I'm concerned, is this a way to transition folks out? And is there a plan then to rehire those individuals? So that ties into our personal lapse savings fund. I'd like to get an answer. I think that's more of a policy, and I'm going back to some comments by President Nez where he mentioned when the government was shut down or we moved to at home or virtual, that they felt there was an opportunity there to reduce the workforce. So I don't expect the consultants to answer. That's more of a question to like RPAC in your discussions and what we should anticipate at Budget and Finance. Thank you.
Okay, thank you for that question. Initially, at the onset with the President Nez's announcement on his during his town hall meetings, we were right in the middle of this pandemic. And so that was the issue with many employees that have been with the nation for a number of years, where they felt that their health was a concern to them as far as being in the workplace. Well, the numbers were high. At the same time, the infection rate was high also. And so the concern of the employees was that they were more concerned about their health as far as going to work, but at the same time coming home, and if they were exposed, then they were exposing their families. So they felt that they had put in enough years to look at some sort of early retirement, but that was not available with the Navajo Nation. Even currently, that's not available, and because we're still going through this process. And so during that time to now, it has changed. The numbers have gone down slightly, which is good. Vaccinations are on the increase, on the rise. So as more people are getting vaccinated and being, I guess, have some sort of protection. And so slowly, the Navajo Nation government is coming back up, opening back up. So right now, the mindset is that it might have changed, but this was in early discussions was because of that, because of COVID. And so right now, I believe that there are, for example, yesterday, I was approached by an employee that worked for the nation for 29 years and wanted to know when the early retirement was going to be made available, because this person wanted to retire early, and they felt that 29 years was enough for the nation. And so the person was looking forward to it being made available so they can take advantage of it. So I think that's where we're headed. But the main thing here is the financial impact to the nation as far as how much money will be paid out initially. And so that was the issue that our controller had throughout the process. And so hopefully that answers your question from our RPAC's perspective. But at the same time, the rest of the committee felt that they needed to keep moving forward, and therefore they voted to move on this restatement of the retirement plan. So hopefully that makes sense.
Thank you, Chairman Henio. And so in these conversations, should we still expect to rehire individuals in these positions, or is there a move to reduce our workforce? Thank you.
Well, as individuals, as we know, that individuals retire in the past, they start receiving their retirement benefits. But within a certain number of years, if they decide to come back on in the same position or a different position, then they suspend their retirement payments. They can't receive two of them at the same. It can't be dual payments. So what happens is even if they retire, but if they come back on, then their retirement benefits are suspended for that duration until they retire again, until they leave that position. And so with this, I believe one of the points he brought out was reduction of workforce. And from my perspective, I don't think this is a reduction in workforce. It's just individual choices of people that were affected by COVID and decided that they needed to be safe and stay home and retire early. And everybody has a right to apply for any open position, whether they're retired or not. It's that can't be discriminated against. So if the position remains open and a person feels that they are still qualified for it and they come back with the application and interview, and certainly if they were qualified, then I don't think there's any barriers that should be put in front of them to where they are not rehired for that same position.
Okay, thank you, Chairman. So as you know, we start the budget discussions next month. I think that's something that I'm concerned about is making sure that there's not a reduction of workforce just based on having individuals through their choice access the this early retirement, or I'm sorry, not early retirement, retirement enhancement. Thank you, Chair Henyo. And so my second question is, if this is an individual choice from the employee, has there been conversations on how Navajo Nation can continue to support their employees that have a number of years of experience but want to keep safe if they have high risk? Was there any type of conversation regarding those accommodations to those employees? I'm thinking similar how we provide accommodations for other health challenges. Let me rephrase that. Do you know, Chair, in these conversations, employees who are concerned about COVID and exposure, if they were given the accommodations that they need, or do they feel like that they have to return back to the office and then would rather take this retirement package than return back to the office? Thank you.
Okay, with that, safe accommodations, I believe that's the responsibility of our Navajo government to protect our employees, and we do have our professionals at Navajo OSHA that, and also with risk management to make sure that those protections are in place before employees are allowed to come back to work. As far as the reduction in workforce and the personnel questions that you have put forth, I'm going to call Ms. Rashida Toddy as from the Department of Human Resources to maybe she can provide more insight as far as the rehiring and also the reduction in the workforce issues. So, Ms. Toddy, are you still on the line?
Yes, thank you, Chairman Henio, and thank you, Honorable Delegate Crotty, regarding the question on the reduction of the workforce. Although, again, the enhanced retirement plan, the purpose of it was to make available such a plan so that those individuals who are currently in a vulnerable population and are afraid to return back to work. That was one of the reasons why President Nez reached out to retirement to determine how many people, employees, would be eligible for this plan, and what other benefits similar to the one in 2009 could be made available to the employees. I do not recall us having much discussion regarding the reduction in the workplace and not having the ability to refill some of the positions. We do have limited personnel at this point in time, and I think it would only make sense to be able to continue to fill the positions. However, most of the reductions enforced during the budget process have resulted in, after the programs do a study and determine that there is duplication of services within the divisions. However, throughout the presentations by the consultants, Ms. Wyatt as well as Bayan, they continuously reminded us that of the savings that would be realized if the nation did not rehire. However, as I mentioned, realistically, I really don't see that happening because of the need for employees in some of these programs. So if they were to there was a large number of individuals that took this plan, I think that we may or may not fill, I would say, at least 50% of the positions back again. Thank you.
Okay, thank you for that. Any other further questions or comments, committee members?
This is Delegate Yeller again. Yeah, can you hear me? Let me maybe remind Rosita, also retirement employees. There was return like that employees when they retire, return, but that was only for now. It's going to get only temporary hiring until they get full-time position. Who's looking for a job. They changed. I think they changed the Rosita on that one. Your side, the only a temporary that can be hired for, I think, no more than 6 or 8 months now. I don't remember that. I heard about it. That was changed because when you retire, you actually retire. You're lucky yourself. You retire because it's really cost on the benefit and liability of the Navajo Nation. So what they do is retirement means you give room to the new younger generation to take over the job. And that's the longer you work, it's going to cost the Navajo Nation cost money to pay for it. That's another issue, number one. Thank you very much. Yeah.
Okay, thank you for that. Any further questions or comments, committee members?
Chair.
Oh, Sunanda?
Chair,
Delegate. Okay.
I have a question. I'm trying to think about it. I know that there's probably people out there already thinking about it, but they're waiting for the response on it. I know that we have a retirement committee that gets together any proposed. There's valuable people for so many years. They carry this Navajo Nation government, so they're at the age ready to retire, and they're more today. Everybody knows about the pandemic. About especially if you're vulnerable to that, is that they will already know that with the people some of them are scared. I don't know with the age that holds the circle. I wanted to know that if there was if these retirement committee, I wonder how many did they any input from people that are at that age concerning. There's some people already asking. They want to know how the BNF, how the Navajo Nation Council will work out this early retirement. Or about case no I call a about this case. I wanted to know that if these retirement committee ever meet people or put in this whole the plan together. That's my question. I call to if you're on that committee, make sure you have contacted them about these people that has that. They're already thinking about it. So they are back the people that are at that age. That's one. I don't know that idea. Okay. I know that some of them Jimmy kind of mentioned about it is that no, we have IHS. After retirement, we still we have insurance, even with this COVID testing, and then also with COVID vaccine, we still go to IHS. We have a Navajo Nation medical coverage. We have group insurance and here had known that we still do that. So it has been go the IHS. I know that anybody from IHS is a part of this plan, where I know that if we go over there right now, I mean, one day that happened to me, all of a sudden, I mean, I went over there and they updated all my chart. They said that they don't know where I was at today working. They did that. So they told me about it, is that, that once you get out of this work, they let us know to update that. About this case ago, once people leave from here, what would be the best way to continue their coverage? Are you recommending that? I know that I kind of heard that if you continue this plan, a certain percent they will be covered. But right now we're not really using it. What's the recommendation? Are the people? Is it best to continue with this insurance coverage, or do we just go with the IHS with that Medicaid insurance coverage again? So that will be who will be the best person to answer these. And I just keep on this my questions down. Still here.
Thanks. That, which I think outreach is concerned. During our meetings, there's really nobody else that calls in or listens in. It's just usually the staff they contact. But I believe Ms. Holmes' Retirement Service Office has received a number of calls and inquiries. So maybe on that part of the question, I'll have Ms. Holmes give you some information as far as what the employees have commented on, made comments regarding this enhanced retirement. As far as IHSA, I think that's more of an insurance and benefits question. And so I believe we do have Ms. Ciccarello on the line, also along with Mr. Dale. Maybe they can assist in answering that part of the question. But Ms. Holmes, if you could provide some information as far as what kind of feedback have you received from employees that have called your office?
Okay. Thank you, Chair Henio, and also Honorable Elmer Begay. Those are good questions, and this is why in the beginning, back in March when the pandemic began, of course, we were closed, and then we came back as essential workers with, in the beginning, we were closed and not to have really person-to-person contact, but although we did use the telephone to answer a lot of the questions. And yes, back in March, April, May, we had a lot of phone calls where it was in the hundreds. We didn't really, I guess if we wanted to pull up our statistics, there's a way you can't really gauge because of the COVID. Some of them were of retirement age and they just wanted to retire. There's some of them that did get scared, and there was a lot of fear and a lot of uncertainties for the employees to come back to work. We heard a lot of sad stories because of those that were lost because of COVID. And it really took an impact on the retirement office here. The retirement officers, of course, we were trying to do our best to keep up in the beginning, and it was a lot, overwhelming phone calls, excuse me, a lot of emails, a lot of request forms that came in, that were mailed in. and I mean, these are, maybe I would say 50 to 75 almost in the beginning, then it kind of is tapering down now, because of maybe the vaccine, maybe because people are becoming more educated about COVID, and of course our due diligence, our masks, our washing our hands, social hygiene is now being educated and imposed on all of us as the Navajo Nation. So with that, as far as a solid number, we did have, we did retire on an average about 15 to 20 employees per month. Some of them were COVID related, and it was sad to see, sad to hear. And, there's just a lot of the fear that was there for our staff to be here and try to cope with this and work with the retirees also as beneficiaries because they had lost a spouse, or, as a beneficiary we have to deal with them. And so it was quite high in the beginning. It was so high where our phone was constantly ringing. I did have to only have a few staff in the office at a time, our staggered schedule. And so we tried to do our best to, not only sympathize but accommodate their requests. And up to today, like I said, that's kind of went down, but they're still asking, is there going to be any incentive for us that, on the COVID-19? Because as mentioned earlier, this was already announced through one of the town hall meetings, and it's not an early retirement program, it's an enhanced retirement program. So some of them, they're not of retirement age, which is 60, but there is still that fear out there. And because of the costs, and we're looking into the next fiscal year 2022, the Navajo Nation, once we find out if this is going to be an impact financially, of course it'll go into the Fringe Rates because that's what we look at, all the financial portion for the impacts on the Fringe Rates. And we do have, we soon will have some preliminary numbers on the Fringe Rate, but I really look to see how this proposed enhancement program, how it's going to go. And so that's what we're looking at. We looked at different avenues, the insurance, without insurance, the cost factors, the implementation. We're not trying to encourage people to leave, but it's as mentioned, their choice. This is voluntary, and if they do leave, some of the people that we're looking at are, of course, are the 60-year-old and above individuals. So if they've been in those positions for years and years, and if the program department decide to advertise that position, that could be a cost savings because the retiree was once maybe across the scale at a F grade, and now that position, once it's vacated, it'll come back to a A, grade A level. So that's where some of the savings could be too. So we looked at different areas, and as far as the number of phone calls for people who are scared and uncertain, in the beginning it was a lot, and now they're becoming, I guess, more comfortable. We do have some that did retire because of not wanting to come back to work because of COVID. But it's up to them. And they do retire. There was, I think, Honorable Crotty was asking about returning back to work. They do, some of them come back to work, and they feel maybe it's because of finances. I don't know what their personal life is like, but they do come back to work about a year or two later, saying it's not helping. And then again, some of them do come back to work temporary, and that's when we started to notice the temporaries were after they retire, they stay in those positions for a year, 2 years. And so the retirement office, we had to put a policy in place to say for temporaries, you're only eligible to come back to work for less than 90 days. And the rationale to that was because when they did retire, they want time to teach somebody that position, the duties and the responsibilities of what that individual once did. So that's where we put in the 90 days for the retirees. If they go over the 90 days, then the retirement office suspends their monthly pension. So that's how we try to take care of the temporary status employees, because as mentioned again, you can't be getting two or dual checks from the Navajo Nation. So, but it did take a toll on everybody in the beginning, and as far as IHS, I'm not really sure how Employee Benefits IHS did that, but that's just my feedback on the number of people that did call us, and so that's what we have right now. Thank you.
Okay, thank you for that. And as far as the questions regarding IHS, Ms. Ciccarello, do you have any response?
Hello. Yes, Chair Henio, thank you, members of the committee. And what I have here is just some numbers, and basically this is what we utilize to determine what the premium rate would be if the plan was going to be offered to the retirees age 60 to 65. And what we did was we looked at our claims experience as far as the usage of the benefits from 2013 to 2019 is what we had that we utilized to determine what the cost would be. And just looking at the cost back in 2013, the number of plan participants that were on the pre-retiree had a net loss of 1.3 million. And so basically what that's telling us is that the benefits were being utilized by those plan members that decided to take advantage of the health benefit program. The following year, 2014, the plan was in a loss of 142,000. I'm sorry, let me take that back. 2013, we actually had a gain of 136,000. In 2014, there was a loss of 142,000. In 2015, we had a loss of 121,000. 2016, a loss of 291,000. 2017, a loss of 500,000. So basically what this is a comparison of the revenue that came in on premium from the retiree and the retirement program compared to the cost of usage of the benefit program for services. And then for the year of, from 2017, a loss of 500,000, 2018, a loss of 146,000, and 2019, a loss of 5,000. So majority of the plan years that we offered the benefit program, members were utilizing. Now, as far as Indian Health Services is concerned, yes, majority of plan members, and it's throughout this whole plan of membership. They utilize the services through the health, through the Indian Health Services, the federally funded program 638. However, there are plan members, of course, that are not in a service area where those healthcare facilities are available to them. So for whatever reason, they end up at an emergency room that's not a federally funded facility, then the plan does receive those claims and makes payment on them. So the federally funded facilities don't pay for those because they were not direct referrals to those healthcare facilities. So let's say we have a plan member that's in the Phoenix area. They don't seek services through the Phoenix Indian Medical Center. They go to, let's say, Banner Healthcare or Mayo Clinic for their emergency care. And then that in turn results in an inpatient stay or surgical procedure. That's where the plan helps those plan members to cover the cost when those services are not referral through Indian Health. And yes, plan members would go maybe for family health care, routine health services through an Indian healthcare facility, but majority of these claims that we receive are emergency room services and inpatient care. So the fund does receive quite a bit of healthcare claims for those members that are 55 and over back from 2009. Thank you.
Okay, thank you for that response. Committee members, any further questions or comments?
Chairman Henio, is there more to the presentation, or did you want us to ask questions? If so, I did have a question regarding for this enhanced retirement. Will this now be the new retirement plan for Navajo Nation moving forward, or is it just based off of the slides where it ends? I'm looking at slide 14, where then it's just available to those individuals within this proposed timeline. Thank you, Chairman.
Okay, thank you. This is a restatement of the retirement plan, but we've had a lot of help from Mel Rodas through this process. So Mel, would you be able to assist in providing a good response?
Thank you, Mr. Chair, and thank you, Honorable Crotty, for the question. This is Mel. So we're thinking that there will be a 30 to 45-day window after the mailing of notices that, the plan exists. And so if participants opt in, if plan participants opt in during that window, then they're eligible and they can participate. They can make the election. But once that window closes, then they can't participate. So it's not that, to answer your question, this isn't going to be a permanent thing. There's a limited window where plan participants can say, yes, I want to take advantage of this option. Thank you, Mr. Chair.
Chairman Henio, if I could ask, if this is an enhanced retirement because of COVID, is this additional cost, are we eligible for any type of reimbursement or support since this is an additional cost to the nation in response to COVID? Thank you. If you're speaking, Chairman, we cannot hear you.
Okay, thank you for seeing that response. I believe Ms. Holmes and Ms. White are buying. Is that the extent of the presentation for today?
Thank you, Chair Henio. I'm not sure if you want Bion with Willis Towers Watson to continue with the presentation to help answer some of the other questions that are coming up. And then just to kind of let Honorable Crotty know about you asked about a reimbursement because it's COVID related. We didn't really take that approach because right now, to our knowledge, this is not, there's going to be no reimbursement. It's just the Navajo Nation taking a step forward to help the employee who are uncertain, who have fear because of COVID, that we're opening this opportunity, the Enhanced Retirement Program, to retire. And it's voluntary. It's not, the whole purpose isn't because of COVID, so we can't really request. I don't know if Mel Brodus has anything to add to that. But right now, we wouldn't be doing any kind of reimbursement, out of like the CARES Act or anything. It'll be a Navajo Nation. Mel?
Mr. Chair, did you want me to respond? Mr. Chair, this is Mel.
Chair Henio, are you still there?
Oh, no.
Vice Chair Smith, you may have to step in. Chair Henio, can you hear us?
I think his call dropped.
Going
Vice
once,
Chair Smith?
twice, 3 times. No Chair Henio. Go ahead, Mel. You got the floor.
Thank you, Mr. Vice Chair. Just briefly, I concur with what Ms. Holmes was stating. To be eligible under the CARES Act, assuming that the nation gets more CARES funding, and that's definitely a possibility. And assuming that the eligibility requirements are the same to use the funds, and we don't know that yet. The expenses, the costs that we incur, have to be incurred. They have to be necessary and incurred because of the pandemic, as a result of the pandemic. And so there might be, as Ms. Holmes said, there might be plan participants that opt to accept this option, this enhanced retirement plan, for reasons other than COVID. It might just be that, they're eligible, they want to take advantage, they have come to the end of their career and they feel that it's time to retire, or they might have an employment opportunity elsewhere, not with the nation, and they might want to get retirement with the nation and then work somewhere else. And so it's because the plan eligibility isn't tied to COVID, it'll be very difficult to make the argument to the federal government that we can use CARES money for it. Thank you, Mr. Chair, Vice Chair, and Honorable Crotty.
Okay, thank you for that response, Mel. I'm sorry, committee members, I lost signal here for a little bit, but I'm back on. With that, we do have, it's 12 o'clock, so Brian or Ms. White, do you have anything further to present?
Hi, this is Brian I think barring any questions, I know Andrea wanted me to go through slide 11 again. If Andrea, do you still want me to do that?
Yes, just to bring us back to the take rate of 61% and how the financial impact could be.
Yeah. So I know there was a little bit, a few comments about filling in the positions. Again, slide 11 has been prepared, assuming 70% of the payroll that was just the positions that were just vacated. That 70% of that payroll is used to fill in those positions. So that's what slide 11 reflects. And the funding, using that logic and that assumption, the fringe rates would increase roughly around 2.2% under just the 3 years of service proposed enhancement, and that's to fund this enhancement that's being proposed. I know there's another slide, which is slide 23, and the reason that's in the appendix is just kind of shows what the impact would be if the people or the vacated positions were not being replaced. But again, that's just kind of to illustrate what it would look like. Slide 11 is kind of what we've seen happen with other clients as well. Normally, is if there's a window and this position has been vacated, some of them are redundant. They may not be filled in, but there's going to be some positions that are going to be filled in by either new hires, sometimes rehires, or just promotions within the nation. And the one last thing I would like to note is slide 14, the timeline. This has been updated from the previous presentations that you may have seen, or some of you may have seen. So this is reflecting an October 1st payment date, and also assuming around by mid-March approval from all the committees, and everything's kind of ready to go. So if that were to change, this timeline could change as well, and could move the date October 1st. If there are no other questions, I don't have much else to add.
Okay. With that,
Chairman,
Shananta, you have the floor if you have a question.
if I could just get clarification and go over slide 19, that would be helpful. Thank you.
Okay, if you could buy it.
Sure.
Slide 19.
So slide 19, it's a slide that we put in there from the December RPAC committee that we had. So it's just showing the financial position of the retirement plan as of October 1st, 2020. So we're looking here. We're seeing the assets are $1.026 billion. That's as of October 1st, 2020, and these are preliminary assets. We're still waiting for the final audited assets to be finished, and once we get those, we'll have the final amount in the report. And then the liabilities, the accrued liabilities. So these are representing the obligations that the nation has to its plan participants. So we've color-coded them by group in there, but the total is $1.1 billion, and that's resulting in a funded status of around 93%. And then we also have, if you look at that table there, we have that 6.4%, that's the current, that's showing the 93%. The estimated fringe rates in there, again, these are fringe rates based on these preliminary assets that we have. I think in the next few weeks, we're going to be preparing finalized fringe rates once the final assets are available. So it's 14.5% for the regular group, law enforcement group is 19.5%, and 43.4% for the judges group. But we added two more columns to kind of show what would happen if some of the assumptions or the asset experience was different from expected. So if the discount rate decreased to 5.9% from the 6.4%, you see that that's going to impact the funded status negatively, because as the discount rate decreases, those obligations, the actuarial accrued liability, that goes up. So that means the funded status would drop to roughly around 88%. And accordingly, the fringe rates would also increase to help fund that decrease in the funded status. So, for example, the regular group would go from 14.5% to around 18.7%. If we look at the third column, where the discount rate didn't change, however, we have that asset return is, for example, like a 10% loss instead of that 6.4% return that we're expecting. Well, the assets would be lower than expected. So that means the funded status would be lower than expected. So it'd be 76% instead of the 93%. And again, this would also impact the fringe rates. And we would expect, for example, the regular group to go from 14.5% to 25.2%. And we have that yellow box at the top there. And that's kind of, I think one thing we always stress is that the retirement plan is now over $1 billion in liabilities and assets. So it's a pretty sizable financial risk to the nation. And we have an example in 2008 where there was a 16.4% loss, and this is when the plan wasn't this big. It did reduce the funded status by over 20%. So as we keep on going, working with the retirement plan, this is the one risk we want to kind of look at, make sure we review it, we keep track of it, and manage it as the plan continues to grow. And more people retire, more people are hired, and so on. We did add a couple bullets there to kind of include ways of managing this risk. For example, annuity purchases or lump sum offerings to kind of pass. This is what other clients have done, is that they get the insurance companies to kind of take over some of these annuities, the lump sums, which then the insurance companies manage. However, I'm not sure that it's something that the nation could be considering. But the other thing to look at is what we call LDI, liability-driven investing. So you kind of match your assets to what you expect to pay on your liabilities, and that way, when you have large fluctuations in the market, your assets don't move up as much because you've kind of fixed cash flows to kind of come in when you're expecting to have payouts go out to your participants. Well, again, these are things that we go into in detail in the RPAC, so I'm not going to dive in too much into them here unless somebody has any specific questions. Slide 20 as well, we had in our RPAC presentation, and this kind of shows the nation compared to the surrounding states. So the nation is that red bar in both of those graphs. So if you look at the graph that's got the funded ratio, that's to the left of the page, we're showing the nation at 10/1/2020, so October 1st, 2020, at 93% funded, which is higher than most other states. The closest is Utah. And then if you look at the graph to the right hand with the discount rates, the nation uses a 6.4%, which is much lower than all the other surrounding states. So that means even at a much lower discount rate, the nation's better funded. So if you were to move the nation up to a higher discount rate, just to compare, or maybe the other way around, if you were to move the other states to a Navajo Nation's discount rate, their funded status would be much lower than what we're showing here. So the nation's kind of in a very good position compared to the surrounding states. And we compare for example, the Arizona Public Pension Plan, the New Mexico Pension Plan, the Colorado Pension Plan to the Navajo Nation. That's pretty much what the two slides represent. Are there any questions? Any further questions on the slides?
Chair.
Oh, Albert Begay?
Yeah, I have a question to let I know that when you look at the slides, the eligibility and it says on here that the exclusion is police officers, judges, and council delegates and political appointees. So if you have, for example, if you made 20 years with the Navajo Nation, and maybe maybe a term for the council delegate, and then there's a term for political appointee that you did with Navajo Nation. So if you wanted to retire now, where does so if you can does this benefit or does this plan includes all the years that you did with the Navajo Nation? It doesn't matter if it was being a council delegate, political appointees, or being being an elected official, or did it have to be separated just only for the year that you've been with being a Navajo Nation employee, not with being an elected official or political appointees? If you want to retire that, if we retire now today under this plan, can you give me some information on it? How do we go about it?
Andrea, do you have a response on that part?
Thank you, Chair Henio, and thank you, Honorable Begay. In reference to the slide 5 of where it says exclusion for the council delegate or political appointees, law enforcement, so forth, we do give credit to those that are excluded if they do decide to take the enhanced retirement program. And I'll have Ms. Delphine Martinez go over that portion of it. Delphine.
Good afternoon, Chair Henio and Honorable Begay and the rest of the Budget and Finance Committee. This is Delphine Martinez. I'm the retirement officer that kind of oversees the defined benefit plan. So Andrea alluded to page 5 of the handout, and for this enhanced retirement program, the exclusions are going to be the commission law enforcement officers, judges, council delegates, political appointees, temporary employees, and all others that don't meet the criteria. Now, as far as what we include when we run calculations, we're going to include all regular status employment for those that are eligible, and then as far as that would pretty much cancel out all those positions that I mentioned. If an employee did regular status and law enforcement, we will add this to their current employment title, as long as it's not law enforcement, but they can also retire under the law enforcement retirement. So if an employee was a regular status employee and a commissioned law enforcement officer, they will get 2 retirement benefits. And the reason why it's 2 is we have to separate their titles, one as a regular employee and one as law enforcement, because the way we calculate their benefits for these 2 positions are different. And same with council delegates. If someone had been a council delegate and they're now a regular status employee, we will include the time that they were a council delegate, so long as it wasn't prior to February 15, 1989, because prior to February 15, 1989, employees serving at the pleasure of the President, the Speaker, the Navajo Nation Council, they were not eligible to participate in the plan. But if they were a council delegate after February 15, 1989, we will include that in their calculation along with the number of benefit years that they've worked as a regular status employee. So if someone was also a political appointee after February 15, 1989, but now they're a regular status employee, the time that they were a political appointee will be included in the calculation. I hope you understand my response, my answer.
Smith, Delegate Almond-Begay, are you good with that response?
Yeah. So the way I understand it is that for myself, would be the third term, which would be if I under this plan if I was a regular employee right now. So I would count the years that I've been with being a regular employee, and then with the terms being a delegate that would go towards my vested years with the nation, the total being with the Navajo Nation. So the total will include my being a regular employee and then being a delegate, and then also a political appointee. So that the whole year vested with the nation would include all of it. Is that the way I understand it?
Back to Delphine Martinez.
Yes, thank you. So for Council Delegate Begay, we are looking at your status right now as of today, which you fall under Council Delegate. So you wouldn't be able to apply for this enhanced retirement program because your regular status position that was previous is not the current title that you hold.
My question was, for example, this is just if I wasn't a delegate, but I was a regular employee now, how would that work?
If you are a regular employee now, you will qualify, and we will include the time that you were a council delegate, so long as it was after February 15, 1989.
Okay, thank you for that, Chair.
Mm-hmm.
I have another question. I know that right now, I'm not sure, but I know that the main emphasis and then the mission, the goals that the Navajo Nation as a delegate, and then also the three-branch government, their whole mission is not to lay off anybody else, or that's what the whole idea or the whole goal is. Don't matter, but even though if we can go the annual revenues, even though that we'll be looking at a shortfall on the revenues, but if that happens somewhere that there's going to be a layoff, and people right now might think employees out there are thinking about their position now. They're probably that comes down to where if the revenue is declining and they're expected layoff from their department, if their position is at stake of abolishing it, or not to reconsider that. Kind of that where the department or program needs to notify the employees now, so they can look at what we're looking at in his plans that we have right now available. Since it's going to be available, if they were told now, I mean, being an employee, if I was employee and I'm thinking of that I'm not sure if I will continue working because the way the budget is formulated and the way the revenue is going. So it's just best to go with this retirement now, or shall I wait until the decision of laying out people? So I'm pretty sure people are out there thinking that way. So how can we explain this to them, or how do we know that we guarantee that there's going to be no layoff for people this year or next year on the next budget? That is my question, Henio.
Okay, that back to Andrea.
Okay, thank you, Honorable Henio and Elmer Begay. When we introduced this enhanced retirement program, the intent was not to lay off anybody or to abolish the position. Our intent was because of the people that are in uncertainty. So we looked at their health condition and their age. So based on that, that's where the 60 normal retirement age came up. If the department and programs looked at it to do a reduction in force or abolish the position, then from the retirement standpoint, that's not how the retirement is to be used. The retirement is to help the employee to retire, to start a new chapter of life, not to do a reduction in force. So, but we do look at all the years of each employee that does decide to retire, whether it's regular status, law enforcement, political, council, even temporary. So those are all the things that we take into consideration when we do the calculation when they decide to retire. But as far as a reduction in force or to be misused, that's not our intent here. Thank you.
Okay, enough for that response. Any further questions or comments on committee members?
Chairman Henio, this is Delegate Crotty.
Go ahead, you have the floor.
Okay, thank you. I appreciate that response on the slide regarding the retirement fund. Chairman, at one time and for a while, Budget and Finance and HES Committee on the prior council would meet regarding the retirement fund. And at that point, it was discussed, in terms of maintaining, I don't know what the term is, like the fund balance or the anticipated fund. There's a certain percentage. I just need to know with this amount and understanding that it's for a limited amount of employees at a limited amount of time. Should we anticipate the need for supplemental funding to assist with this increased cost, or will the retirement plan, and it's hard to anticipate because of the market, how are we going to absorb this cost? Thank you.
I think our funding percentage is at a really stable percentage right now, meaning that
I believe, Andrea, what's our funding percentage? Is that above 80 right now?
If you look at slide 20, and our funding status level right now, we're sitting at 93% with the current conditions. And in order to sustain this 93, of course, we need to keep our funding level good. And even though we do have a shortfall of $77.2 million, in fiscal year 2021, actually every year, the retirement office, we do request a fixed cost amount of $10 million just to help fund the trust. And for fiscal year 2021, our fixed costs got zeroed out. So I'm glad that I hope we do get supplemental funding, and it's just to put us in a better position and to continue to keep our funding status at a good level. Not only the percentage of 93%, but because the Navajo Nation pays for our defined benefit program, we'll be in a better position. And with the ERP that we're putting in place, whether we have no insurance or insurance, that additional cost will be included in this shortfall. So if I have some additional funding to add to the trust, then of course it's a plus. And this is where we try to every year request from OMB for that $10 million to be part of the upcoming fiscal year budget. So right now we are okay at 93%, but who's to say how the market will be, how inflation will come. And then as Bayan mentioned, looking at the unaudited assets to give us a better picture based on the presentation, we're still in a good situation, and that's where that that funding level it'll increase, but I think we'll still be okay if we do that proposed enhancement with no insurance. We're looking at a $37.6 million increase, 7.2. But if we consider the insurance, we're looking at $44.9 million added to that 77.2 shortfall. So just kind of keep that in mind. And I would like, the retirement office would like additional funding to be added to the trust just to for future. You know, we it's kind of like one of my former bosses kicking that can down the road. You know, we want to make sure that it doesn't go too far. You know, we have to still stay obligated to our Navajo Nation employees along with the retirees. So that's where this funding level comes in at 93%. So once we get the more the audit assets that Bayan talked about earlier, it'll show us a better amount on the fringe rates from one of the previous slides that was mentioned on fringe rates. So those were just estimates. Thank you.
Okay, with that, I believe that being funded at 93%, that is very, very good compared to where we're at years past, when we were sitting below 80%. If you look at other states, they're not as, I guess you could say, high as the Navajo Nation is. It's because of our the way we have our investments, and we're diversified to where the funding level percentage is high now. And 93% is high, very, very high. Compared to states like New Mexico, last I heard they were around 77% maybe. or even below that. State of Arizona the same way, where and so if this type of enhanced retirement plan were to come before the states, it would really have a big impact on them. But with Navajo Nation being the way our investment portfolio is, I believe that we are sitting good right now. And as you all know, the market has been an upswing ever since summertime. Even oil is right now at $61 a barrel. And you've seen that the gas pumps right now are gas is like $2.50 something a gallon, and moving forward with that. So I believe that one question that still remains and needs to be answered, and maybe I don't know if Andrea can fully answer this. We've asked this at RPAC, but there was really never a clear, straight answer. Was what are the funding impacts, financial impacts on this enhanced retirement if we have a rush to people wanting to retire all in one day? So I don't know if you'd be able to answer that, Ms. Holmes.
Okay, thank you, Chair Henio. But right now, yes, our retirement trust fund is in a good position, but we still have to be careful. And because most of the monies that we gather is from our Fringe Rates, so we have to make sure that those positions are filled, because the way the system operates, if the position's vacant, then of course it's not going to grab that Fringe Rate so we can put it into the trust. But as far as the financial impacts, if someone was to, if we'll say 698, which I'll take this position, the ERP, of course our funding level will be impacted, and we'll need to probably ask for more money. But I can ask Bayan to, because he's our actuary, what could happen. So Bayan?
Yep, hi. So, I mean, if we look at slide 22 really quickly, we can see the first thing is just in the funded status. So if everybody were to take these offers, you know, as an example, on the blue column, that funded status would decrease by around 3.5% roughly, and around 4% if the medical was offered at 100% paid. So that would be an impact on the funded status. However, in terms of fringe rates, yes, you know, you expect the fringe rates to increase, but I think it's kind of like a two-step impact. The first step is if the positions aren't filled in time when we do the valuation or for the fringe rates, you know, we're going to have a low earnings base, so not as much is being paid in terms of a salary to your Navajo Nation workers. However, that pension plan, how much you need to fund that deficit, that amount doesn't change for the most part. So we're just determining a fringe rate using a lower earnings base, so that means the fringe rate is going to be high. So that's why slide 23, when you look at slide 23, if we use the Enhanced Retirement Program as an example, under the blue column, the very bottom you see the fringe rate increase is 4.3%. If everybody, if all the 61% were to take it and there were no replacement hires, if you compare that to slide 11, that number is 2.2% if you were to replace some of those people. Right? So that means you have people that you're going to replace, so you have an earnings base. And then the way you determine the fringe rates, part of it is you take that shortfall amount that you need to pay into, you know, every year, the amortization amount, you divide that by the earnings base. So if your earnings base is bigger, that fringe rate is lower. If your earnings base is smaller, that's going to impact the fringe rate by increasing it. So that's the first thing. The second thing is, after you set fringe rates, So, for example, let's say we set fringe rates for, right now we're going to be setting fringe rates for fiscal year 2022. We're going to use the most recent earnings that we have, so to reflect the most recent conditions. However, if you were to do some kind of program later on and you have a bunch of Navajo Nation people are vacating, you know, that fringe rate has been determined assuming those people are there, but if they're not there anymore, not funding the plan as enough as you should be. So that's kind of like the second part of it. I'm not sure if that made sense to everybody. I'm wondering if there are any questions at this point.
Okay, any further questions or comments, committee members? Okay, I believe that we are at the tail end of our work session, so we've had a good dialogue with between the Budget Finance Committee and our presenters, and therefore I think we need to move forward unless if there's any questions or comments. I do hear Delegate Elmer Begay on the line.
I thank you for that again, Cecilia. I'm trying to think about what I know that a lot of employees will start ask these kind of questions. But my question here will be what will be the projected time frame when this enhanced program might be offered? When is it going to be offered? And then when will it be ending? How long does it? How long is the duration of this plan will be offered and will be available for employees? That will be my question, Cecilia.
So, Andrea, let's say legislation comes before being in the month of March, and it's passed by BNS. What's the time frame of implementing this enhanced retirement after it's passed by BNS?
Okay. Thank you, Chair Henio and Honorable Begay. Thank you for the question. For the timeline that we're offering this based on the presentation today was for regular status employee who meet the criteria as of December 31st, 2020. But if we do decide to move that date because it needs to go before BNS approval, we were looking at another date of March 31st, which would increase only 18 people who would be included in that. But of course, based on the presentation, looking at the cost, the impact of that, if we go with the alternative one that was approved by RPAC, which was the additional 3 years of benefit service with no insurance, then it's going to be an additional cost of that $37.7 million added to the plan. So that was the proposed language that the RPAC did approve. And so if we push it out to March 31st based on timing, that is possible, but just keep in mind that $37.6 million will increase for the 18 additional people who will be included in that. So maybe we're looking at, I don't know, maybe additional 3 million or so. Bion would have a better idea on a proposed addition to that 37.6 million. So it might jump to, I'm just going to estimate 40 million added for the additional 18 people. Or it's actually 16, I'm sorry, 714 minus the 698 is 16. If we move the eligibility to March 31st. And we can, once we come up, if that's what we're going to do, then we can come up with the new numbers for BNS. Thank you.
I mean, so what would be the implementation date? That was the question.
By the age, once you get to 65, that's it. If you get 60 years old, 5 years of insurance.
So Joe, get y'all here. Can you mute your phone, please? Implementation date. Andrea.
Yes.
When would this retirement plan be implemented? That was the question.
If you go to the timeline, page 14 or slide 14, this is some of the timing that we're looking at based on the approval through once the legislation is given to legislative, and then it's dropped and all that. This is what we're anticipating on the date. So we would start June 4th? Yeah. So we would begin the ERP distribution on June 4th, and then do the election period June 11th. And then, of course, we still need to do some communication and education. That will be, excuse me, in July.
Okay, thank you for that. Now, Delaware, were you anticipating?
Deadline.
Oh, yeah, thank you very much. Excuse me. The eligible population retirements again. Insurance is a little bit different. If employed 60 to 61 employed, AA 201, auto 62 but not 64, AA 246, 80 units or 447. Niti retired it's going to be based on how many years they put in. Yeah, if they put in like maybe 20 plus years, some of them they will retire. Auto Saidi Nidia, Sashibata Taho, Auto Junidan, the Shinka COVID-19, but it was needed or retired, she done with a cook. What's that? Eating packaging, because it's going to be just like they're going to work now, then they're going to be on full benefit on medicals. What IHSA does not cover everything, but like once you cover in 65, AI, see, 60, they sent you out to the other big hospital. Oh, doctor, the patient get of a car, not just the Nahashi on that or the airplane with the unloaded snow, the Johannesburg. Kadeya, Oya, and peso under our federal money that they have. They had done they won't send you out. All that they cannot sue the fact they are was that then the odds on me. But I want this kid, he's international on this kid. He got for the age of 60 to 64 years old. That's good for benefit, good for them. But going to be based on how many years you put in that 2%. Once you get to 65, it's going to be regular retirement with no medical stuff. Yeah, you go under Medicare. Ako tayo ba hasis kala chair to mas chair to sina sini Lina committee. So yeah, thank you very much. That looks okay. Could chair.
Okay, Sheena. With that, any further questions or comments, committee members? Okay, that was a final response, Andrea. Then we'll go and close that up.
Thank you, Chair Henio and Honorable Yellow Hair. As far as the insurance and the 400 people that could be eligible, yes, it's true. Everybody does need some kind of health insurance, and a lot of them do rely on IHS. But the way the RPAC approved the proposed alternative was with no insurance. Thank you.
Eugenio, are you still there?
Okay, thank you for that response. With that, though, I don't think there's any more further questions or comments. So, if you have Ms. Holmes, Department of Retirement Services, Willis Towers Watson, thank you for that. And then also, nomination of Risk Management, Mr. Carrillo and Mr. Dale for being on the line with us. Also, Mel with Department of Justice. And so with that, we'll accept this report as part of our work session. And let's move forward to closing of the session. It is 12:47 p.m. And so we have a good long dialogue. With that, though, we'll call for adjournment. Just for formalities, is there a committee member that wishes to adjourn?
Yellow Hair will request for adjourn.
Gashish and Delegate Yellow Hair request to adjourn.
Delegate Brown will second.
Gashish and Delegate Brown second that. Go Canos and for a really good discussion. And we have a request to adjourn from Delegate Yellow Hair, second by Delegate Brown. With that, I'll make consensus. Delegate Yellow Hair, are you good with adjournment?
Yes, I'll vote green. Thank you.
Good. Vice Chair Smith?
Green.
Kushina Ashna, Delegate Amber Canos-Bacrati.
Delegate Amber Canos-Bacrati votes green. Thank you.
Kushina Delegate Nathaniel Brown. Delegate Nathaniel Brown.
Delegate Brown votes green.
Kushina Delegate Elmer P. Gay.
Should I vote green?
Kushina, allow for that. So we are hereby adjourning our work session at 12:49 p.m. Thank you. Have a good Tuesday and the rest of the week.
And I just want to say thank you to everybody that was on the call. Thank you to Budget and Finance Committee and all the honorable council delegates who were on the call also, and employee benefits, risk management, DOJ, and thank you. Have a good week.
Nito, she had